Hey guys, it's Jenny on the block, and today I am here with Dr. Clarissa Polen-De. She is a gynecologic oncologist at Summa Health. So, welcome, doctor.
Thank you so much for having me today. Really appreciate it.
Of course. So, tell us what a gynecologic oncologist does. That's a mouthful, first of all. So, what do you do?
Yes, yeah. So we are specialists that manage women's cancer. So cancers involving the uterus, cervix, ovaries, vagina, anything in that realm.
Okay, all right. So, that's a lot of different pieces and parts, but uh, I guess the real question is this oncology is cancer, yes?
Yes.
So, wondering what gynecologic cancers should women know about? Because I know there's quite a few.
Yeah, like you mentioned, there are quite a few. The most common female cancer that we manage is endometrial cancer. Overall, the most common diagnosis, but often curable when detected early. And ovarian cancer, while less common overall, it is often diagnosed much later and so can be much more dangerous.
Got it. So, symptoms. I know a lot of us get busy and we might ignore symptoms. What are symptoms that we should not ignore when it comes to this sort of thing?
Right. So any really persistent bloating, early appetite cessation, like decreased appetite, any abnormal bleeding, so really heavy bleeding or irregular bleeding, postmenopausal bleeding, any persistent abdominal or pelvic pain or pressure, and really just listening to your body, any abnormal symptoms that have persisted and that you have a concern about.
Okay. And then are there screenings for gynecologic cancer?
So that's a really good question. We often think of PAP screening, right? Like PAP testing, getting your PAP test done. The important thing about that is it really only screens for cervical cancer. So sometimes we have a misunderstanding that it also can test for ovarian cancer, uterine cancer, but it does not. Unfortunately, there aren't good, reliable screening methods for ovarian cancer or endometrial cancer. And so, really listening to your body, making sure you go in for those annual evaluations, regardless if you're getting an actual PAP test, is really important.
Yeah, I was going to say, I feel like the PAP tests seem to have changed in recent times, where you don't have to get it like every time you go.
Right.
Um, is that
Yes.
okay?
Yes,
So kind of
definitely.
how it comes out, right?
Yeah, and so women will oftentimes think, oh, I'm not due for my PAP test for 3 to 5 years, so I'm good. I don't necessarily have to go in. But it's a really good opportunity. Like you said, we all get busy. We're all focusing on family, so many other things to check in and see, actually, maybe I am having abnormal bleeding, or maybe I am having, some pain, some things that I've been saying, trying to put off. So it's a good time every year to check in with your GYN and have that opportunity to get an exam, go through symptoms, and make sure everything is up to date.
Okay, great. And then is there anyone who might be at higher risk for these types of cancer?
So, any patients or any women who have family members that have had an ovarian cancer, uterine cancer, potentially colon cancer, or breast cancer can be at higher risk for having a cancer diagnosis themselves. And so, talking to your OBGYN about that family history and potentially getting testing to see if you might have a genetic abnormality that puts you at higher risk of having a cancer diagnosis.
And then if women are concerned, what should they be doing?
Definitely reach out, talk to your OBGYN, talk to your providers, ask direct questions. And if you feel like you're not getting the explanation that you feel like you need, asking for a second opinion is okay. Early evaluation and detection saves lives. And so it's really important to listen to your body and then reach out to your OBGYN if you do have any questions or concerns.
Great. Well, I really appreciate you being here. I wanted to mention if you guys have questions or want to get more information, you can go to summahealth.org/cancer. Again, summahealth.org/cancer, or you can call 877-205-1082. Let's see if I can do it right. Dr. Polen-De?
Yes.
I did it. I just wanted to say thank you again for being here with us and talking a little bit about this because I know a lot of women out there are confused. They don't know what to do. And this was a great opportunity to kind of share what you're looking for when you might be suspecting some sort of a gynecological.
Yes. Thank you so much for having us.
Yeah, thank you.
Thank you.